Hi, come in. Please do take a seat. My name's Dr. Toki. It's a pleasure to meet you. I know it can be nerve-wracking to meet a new therapist, and I'll be asking some personal questions today, so I thank you for taking the step to come in, okay? Today we will have a little bit of a different meeting than what is a regular session. Today I'll be asking you some nosy questions just so I can really understand what's been going on. But don't worry, you can ask me nosy questions right back if you want to, but it is also okay if you don't have any at all. That's absolutely fine. Now, after I've asked you my questions, I'll share with you my thoughts, my observations, about the things that you've told me. You always know what I'm thinking, and to make sure that I really understand what it is you're saying. All right? What I'll do after that is I'll share with you my initial thoughts and a plan for how I'm going to help you to feel better, okay? Great. Okay, let's start. Okay, let me just take some notes. Right, now I know we spoke briefly on the phone, but I'd like to start with a really broad question, if I may, and we can go from there. So what brought you in here today? Okay. You've been feeling really anxious. I see. Okay, I'm so sorry you've been dealing with that. I understand that it's really hard. We see a lot of that in our practice, so I just want to reassure you and let you know that you are not alone. Now, can I ask you, when did this start exactly? So was that during your studies or? Right, okay. And how bad does it get? So if you get on a scale of let's say 1 to 10, 10 being extremely difficult and 1 being sort of tolerable, where would you rank that on a scale of 1 to 10? Okay. And what else? Is there anything else? Panic attacks. Okay. And how many? When do they occur? Right. Okay. And given all of that, how is that impacting your life right now? Yes, it's difficult. I understand. Okay. And are you taking any medication for this? Right. Okay. And they were prescribed by who? Right. Okay. I see. What helps you right now in dealing with this anxiety? Your friends, right? Okay. And who knows about this? Your parents, okay, and a couple of your friends, right? And would you sort of consider them your support network? Right, that's very important. It's very important to talk about these things, okay? Great. And do you have a family history of this at all? Right. So you're not sure. Okay, that's fine. It's absolutely fine. Now, quick question. Have you ever seen a counselor before for this or for anything? You have, okay. And when was that? Okay, so that's about a year ago or so. Now, was that helpful? Okay, now was there anything that wasn't helpful about seeing the counsellor? So I really hear you about the anxiety, and I'm starting to think of a few things we can do together that will really help you with that. But first, let me ask you, is there anything else going on with you that you think is important for me to know? No, nothing comes to mind? Are you sure you can tell me absolutely anything? I'm here to listen. Okay, well, if anything does, come to mind, feel free at any point during this consultation to let me know. Okay? Great. Perfect. Well, thank you for answering all those questions. I know this stuff is really hard to talk about sometimes. You can't just make it go away by being hard on yourself, because obviously if you could kick this just by telling yourself, to be calm. You wouldn't be here right now, but you are, and I'm glad that you are. You don't need to be alone with this anymore, and I'm here to help you. So in our next session, I'll ask some more about, your symptoms and really make sure we get the right idea of what you're dealing with. But I'm pretty confident in what I've heard that the focus of our work will be on tackling this anxiety together. Okay? Perfect. I am positive that we can get this under control and, get you feeling like yourself again. Right. So if you do choose to work with me, I think first of all, we'll construct a plan, some concrete practical tips and tools to help you with the anxiety. Yes, of course, I totally agree. I mean, it's very important that we explore, the causes and the things that trigger your anxiety so we can take, should I say, an offensive approach. We want to see those things sort of coming before they happen. Right, exactly. That will give us the opportunity to sort of plan ahead of time. Right, and how are you sleeping? Okay, well, that's absolutely fine. I can suggest some pretty easy tweaks to help you with your sleep routine, to help you get a better night's sleep. And of course, that in turn will help with anxiety. That is absolutely normal. Yes, it's absolutely normal to have felt alone. But I think in around 3 months, based on my work with other clients, we're going to see some really positive changes. Yes, around three months. Okay. Well, we are almost out of time. I'm sorry to have to stop. We can do one of two things. If you feel comfortable that we're a good fit, we can go ahead and schedule our next session. And I think it'd probably be good for you to, let's say, see me once a week. Okay. But again, if you'd like to think about it, that's also fine. If that's the case, I can drop you an email and we can follow up. Perfect. You are? You're feeling confident? That's amazing. Happy to help. Right, okay. Well, you enjoy the rest of your day. I'll be in touch with you. And if you have any questions in the meantime, feel free to contact me. All right. Nice to meet you too. Okay, bye-bye. What a lovely, lovely individual. Okay, let me quickly just send the email. Okay. Where are we? I really enjoyed meeting you today. Talked about some hard things and I appreciate your openness. I was thinking further about your panic attacks and wanted to share this article with you about riding out panic attacks. If you'd like to meet again and get started on the goals we spoke about, let me know and I will find a time that works with your schedule. Kind regards, Dr. Toki. Okay. Hi, Sandra. Can you send in the next client, please? Perfect. Hi, good afternoon. Take a seat. Let's begin.